Hello, my name is Greg Camarada, and I will be the nurse taking care of your child today. To start, can you please verify the child's full name and date of birth? Thank you. Today, we will be discussing the relevant steps of a tube feeding procedure so that you can feel comfortable performing these steps yourself. We will be conscious of cultural considerations or any developmental requirements which will be crucial to the effectiveness of any counseling approach. To start, let's review daily routine care. First, assess the site for any abnormalities. Stabilize and secure the tube. Clean the skin around the tube with mild soap and water if needed. Apply any topical treatments ordered by the physician. Change the dressing when soiled, if applicable. Assess the site to identify if there is any redness, streaky, bumpy, or if it is uniform. Is there any swelling, induration? Is there any discharge or drainage? If so, how much drainage and what color is it? Is there any foul odor? Or is there any pain with touching and with feeding? Please make sure the gastrostomy device fits well by ensuring it is not too loose or too tight. Lastly, monitor the patient for feeding intolerance and aspiration, such as choking, gagging, feedings, vomiting, abdominal pain with feedings. Identify the signs of peritonitis and if the device is in the incorrect place. These include difficulty with the flow of formula or medications, abdominal pain with and or after feeding, abdominal tenderness, rigidity, or fevers. These steps should be assessed prior to administering feeding medications via the G tube. Once these steps are fulfilled and evaluated, you may proceed to providing feeding and or administering such medications. Feedings are given continuous and or bolus per pump, syringe, or gravity bag. The patient should be on the right side with the HOB elevated 30 degrees during 30 to 60 minutes after feedings. Bolus or syringe feedings should not be given too fast. The more elevated the syringe is, the faster the formula will run. Always stabilize the G button with your fingers when attaching extensions. Syringe feedings should be to gravity. Do not force. Gently push. Signs of formula intolerance include the following: abdominal distension, cramping, diarrhea, and or vomiting. Some children have a Nissen and cannot vomit. You may need to stop feedings or slow the rate down. Next, let's review how to administer medications via the G tube or G button. Never crush pills that are time released. Do not give medications that dissolve under the tongue or sublingual or are sustained release through the tube. Don't mix medications with formula or in a formula bag unless ordered by the provider. Give medications separately from each to avoid drug interactions. It is a preferred method that medications that are to be given through a G button should be given through the medication port of the feeding extension instead of directly into the button because the valve may become damaged. Give medications through the correct port. Be careful not to give medications through the balloon port. Now, let's review how to clean the equipment. For feeding extensions, wash with warm soapy water or half white vinegar with half water. Flush through with warm water. Hang out to dry or flush air through. You may reuse for 2 weeks per manufacturer's guidelines. Rinse feeding bags and syringes after each use. With all of this in mind, let's review the orders for the patient. Administer 10 ml per hour of tube feeding via a tube feeding pump for 20 hours. Make sure to assess the placement of the gastro tube and elevate the infant's body. Next, administer tube feeding per provider order, 46 ml of formula over 30 hours every 3 hours. Then administer 5 ml of water before and after the formula. Assess the residual before every feeding. If the feeding is above 46 mLs, hold for 1 hour and restart if less than 20 ml. Notify the provider if the tube feeding is not given for over 4 hours. Assess the insertion site of the gastro tube. Daily, cleanse with soap and water. report any redness, drainage, or swelling. Monitor daily weight in the mornings and report a weight loss of 5%. By providing all the nutrients your child requires on a daily basis, tube feeding can help improve energy and strength, preventing weight loss and supporting their immune system. For many, tube feeding is the only option available to keep them alive. Now that you understand the risks, benefits, signs, and purpose of this treatment, you are now ready to safely administer feedings or medications via the G-tube. Should there be any questions or concerns, please do not hesitate to reach out. Thank you again.